Good afternoon. Thank you to the Center for Lyme Action for inviting me to your Virtual Fly-In. I'm Rear Admiral Michael Iademarco, the HHS Deputy Assistant Secretary for Science and Medicine. Our office coordinates HHS work on Lyme Innovation as well as on long COVID. We co-lead, along with CDC, the interagency process with 17 federal agencies and divisions to deliver the first ever national strategy for vector-borne diseases to Congress by the end of this year. This national strategy, which is publicly available in draft form, emphasizes implementation with emphasis on Lyme and tick-borne diseases. For both Lyme disease and long COVID conditions, we believe research and policy must be grounded by patient experience. Science must serve society. Innovation must translate into real-world impact to improve patient outcomes and lives. My office uses human-centered design as the basis of our strategy so that people we serve are at the core of our science, innovation, and policy work. HHS's Lyme Innovation Initiative sees patients as more than the targets for new prevention, diagnostic, and treatment tools and techniques to address Lyme disease and other tick-borne illnesses. Patients are the driving forces of innovation, and their lived experience is our roadmap. Lyme Innovation is about co-creating solutions with the public and patients, driving the process with us in government, listening and learning. As part of our Lyme Innovation Initiative, HHS launched a $25 million partnership, the Lyme Innovation Accelerator, or LymeX, with the Stephen and Alexandra Cohen Foundation. In late 2022, LymeX awarded $1 million to 10 innovators developing Lyme disease diagnostics. Those 10 winning teams now join our virtual accelerator for mentorship and resources to move new Lyme diagnostics to market. LymeX expects another $9 million to be devoted to this project in future phases, thanks to the generosity of the Stephen and Alexandra Cohen Foundation. HHS continues to focus on Lyme and vector-borne diseases as an important national priority. While we know we have far to go, we've learned so much from our work on Lyme disease. Much of the work we have done incorporates patient voices into the national research framework. In turn, it has been a model for the work we are doing on long COVID. For example, the Health Plus Long COVID Human-Centered Design Report is based on over 1,000 hours of co-creation workshops, interviews, and design research. This Health Plus Long COVID report validates and lifts patients' experience while defining opportunity areas where government action is most needed right now. This long COVID work used the successful model demonstrated in the 2021 Health Plus Lyme report, which similarly used human-centered design to surface and distill the challenges faced by patients, caregivers, and those on the front lines of Lyme disease. With challenges come opportunities. One opportunity is for long COVID insights to aid Lyme disease and vice versa. HHS believes we can use the commonalities experienced by patients with both of these conditions to support advances in research, diagnostics, and treatment. For people with Lyme, for people with long COVID, and for the many people who experience similar infection-associated chronic illness, who have so far many years faced an uphill battle. We know long COVID is real, as is late-stage Lyme and Lyme disease that doesn't fully resolve after treatment. These are potentially debilitating physical conditions affecting physical and mental health and challenging caregivers and healthcare providers. Both Lyme and long COVID are complex, multisystemic, and hard to diagnose illnesses that disproportionately affect women. We also see how these illnesses are affecting children and the racial, ethnic, and economic disparities in diagnosis and care. Both chronic illness after Lyme infection and long COVID lack definitive diagnostic tests. So they're surrounded by diagnostic and scientific uncertainty, while patients and their healthcare providers struggle. These complex conditions exemplify the importance of health equity. In both Lyme and long COVID, patient outcomes often depend on their ability to pay out of pocket for medical care, which highlights the need to end disparities and address social determinants of health so that all Americans have access to quality care. We appreciate your dedication to education, your commitment, and your work to improve public health. Thank you.